Charter Oak is an attempt to start to address some of those non-categorical populations, basically the single adults, who are not currently eligible under Medicaid, by providing a state subsidized insurance product that they are able to access. And this is a product that involves, it is very much like an insurance product, very much not like Medicaid in many ways, in that it has a premium responsibility, it has deductibles and co-insurance and co-payments. The goal was to try to design a program that individuals could purchase for around $250 a month, with a sliding scale of subsidies provided by the state. So what you see is a product which is really not as inclusive as a Medicaid coverage would be, but it really is a commercial product. We have 3 MCOs that we've reached agreements with for providing both Husky and Charter Oak. As you know, we had kind of a meltdown in Husky last fall with the withdrawal of a couple of our plans. So we went out to rebid the program. In the fall, we had Anthem, WellCare, HealthNet, and the Community Health Network of Connecticut. Community Health Network of Connecticut being a not-for-profit plan which is operated largely through the federally qualified health centers. As a result of this procurement, we have Aetna Better Health. Aetna is, of course, a Connecticut-based company. They last year purchased a company out of Arizona called Schaller Anderson. Schaller Anderson is a company that does Medicaid-only managed care. They are now a fully owned subsidiary of the Aetna, and they are basically the instrument of the Aetna that's going to be working on Husky and Charter Oak. We have AmeriChoice, which again is a Medicaid-only managed care product. They don't do commercial business. They are owned by United Healthcare. So again, it's a Medicaid-only subsidiary of a commercial for-profit plan. And the Community Health Network, which is a Medicaid-only plan. So the interesting thing that happened, I think, as a result of the transition is that we went from an environment where we had large corporations involved that had both commercial and Medicaid business to now we really are dealing with plans that are really only focused on Medicaid. For a lot of reasons, but I think primarily it's the result of the large hue and cry that we went through last year around freedom of information, where I think basically the commercial plans were saying, you know, we want to be able to draw that bright line on FOI between our Medicaid business and our commercial business, and for whatever reason, they made the decision they couldn't do that. So we're into a new era. Charter Oak has been accepting applications, and the first enrollments are due to begin in August, and the new Husky enrollments will start in September. We had a very nice kickoff event on June 30th down in Rocky Hill. Mike Starkowski likes to have breakfast at a particular diner down there and is waited on by a particular waitress who commented to him for many years that she wasn't able to get health insurance, and so Mike went down there, and Governor Rill went down there, and they took her application as the first applicant for the Charter Oak program. That happened on the 30th. We expected calls to begin soon thereafter. We were immediately swamped. We had 2,000 phone calls the first day. We opened up the phone lines. The call center jammed. We had to go to another overflow. We had another 2,000 the second day. This says 6,500 calls. We're now over 8,000. And we've had about 1,700 people complete applications. In terms of how you apply, we're doing this as a 2-step process. I didn't bring the application with me. But you can go to our website, or you can call our number. And you get basically what's a quick start application, asks you a few things about whether you're a Connecticut resident, approximately what's your income. You complete that, it's pretty simple. And then we'll follow up with you to say, well, based on what you told us, it looks like your premium contribution is going to be XYZ, and then we ask you for some more information. We try, part of the second application is to try to screen people out from applying for Charter Oak who are really eligible for Husky, because we're already seeing that. That there are a lot of people are applying for Charter Oak, and if you really look at what their income level is, they're eligible for a program where they wouldn't have any premium. So we have to screen those people out and make sure if they can get the Medicaid product, which doesn't require them to pay, that's where they reside. That's an interesting phenomenon in terms of how you put these new programs on top of what you already have. We saw the same thing when we started SCHIP back 10 years ago, in that a lot of people applied for Husky B who were already in Husky A, thinking it was a newer, better thing, and they wanted to move towards the more sort of commercial mainstream model, even though they were, technically better off being in Medicaid. This does have co-insurance and deductibles, so there is a point at which people have to pay the first, several $100s before the plan is going to start paying. We split that into 5 bands of income in terms of what people's deductible and co-insurance maximums are going to be. The deductible is what has to be met. The co-insurance is the maximum co-insurance that they have to pay in an annual basis. So there's a cap. I mean, there is a recognition that there is a point beyond which people can't be expected to pay. So, for example, in the 186 to 235% of FPL band, an individual would pay a maximum of $400 a year in co-insurance, and then after that, they're no longer subject to that. So we've tried to stagger it so that there's a little sensitivity to people's income in terms of how much co-insurance they're expected to pay. In terms of the transition, this is probably we are facing many challenges right now. A lot is happening very quickly. This is certainly one of the biggest. We have approximately 335,000 people in Husky right now. About 35,000 of them are in our what we call our faux plan, which is really Medicaid fee-for-service, but that's how we tell the federal government that they're still in managed care. And the others are in Anthem and the Community Health Network. They have to be phased into these new plans sometime between now and the end of the year. We're going to start in September, but in one county only. County yet to be determined. Will probably be determined this Friday. And then we will phase in the others during October and November. If the phase-in is going to depend on what the networks look like in terms of which counties are actually turned on for enrollment. This schedule could slip a month. We want to start in September and finish it between September and November, but depending on how things are going, we could extend that through December.